As promised, I am now going to go through the results from your last two lab quizzes. The first lab quiz was on joints, joint movements, and axial muscles, and this was lab quiz number 5. Here are the results of the quiz. So average was 72%, which is actually pretty good. The only downside is only 17 students took the quiz, and there are roughly 24 students in the class, so about 29% did not take the quiz for whatever reason. 3 students scored 90% or more or better, 5 80 to 89%, 2 70 to 79%, 4 60 to 69%, and 3 less than 60%. In general, I like to see students score above 60%. And so most students who took the quiz did. So that was good. In this question, you were asked, what is the general term for the structure indicated below, which connects a muscle to a bone? This is a tendon. A tendon connects a muscle. In this case, it connects all of the quadriceps muscles to the bone, the patella. So this is a tendon. Specifically, it's the quadriceps femoris tendon, though that's not the answer I was looking for. Just tendon was fine. If you put the quadriceps femoris tendon, I gave you credit for that. But I was just looking to make sure you understood the difference between a tendon and a ligament. This is a tendon. Several students answered ligament. A ligament attaches a bone to a bone, such as the patella ligament. It attaches the patella to the tibia, specifically the tibial tuberosity. So this is a ligament. This is a tendon. Make sure you know the difference. In this question, you were asked to identify this muscle, and this is actually a muscle group because you actually have two muscles here. You have the rhomboid major and you have the rhomboid minor. And I don't hold you responsible for distinguishing between the two, just long as you can just identify it as a rhomboids. That's all I'm asking. And it's named after its shape. If you look, it's shaped like a rhombus. A rhombus looks like a leaning square, and that's what this is. Now, a lot of students confuse the rhomboids for the trapezius, as this student did, answered incorrectly as the trapezius. The trapezius is located in the same area as a rhomboid, but it's more superficial. You can only see the rhomboid here because the trapezius has been removed from this side of the muscle model. The trapezius is shaped like a trapezoid, right? Has an origin here, insertion here, and then insertion along here. So don't confuse the trapezius with the rhomboid. So make sure that you can distinguish between those two, because if you made this mistake on the quiz, you'll turn around and make the same mistake on the practical, okay? Now let's turn to one of the joint models where you have to identify structures. Now the joint models, that would include your shoulder joint, elbow joint, hip joint shown here, and the knee joint. On those models, you're asked to identify various ligaments. And remember, ligaments attach bone to bone. And the wonderful thing about these ligaments, they're named after the bones that they connect. So here you're looking at the coxal bone. Remember I said you don't have to know the coxal bone, you have to know the bones that make up the coxal bone, which include the ilium here. This is the ischium, the sit-down bone. So we're looking at the posterior side of the coxal bone. This is the femur right here. Here we have the greater trochanter and the lesser trochanter. So again, you're looking at the posterior side. And you are asked to identify this ligament here. This ligament connects the ischium with the femur, and therefore it is the ischiofemoral ligament. This particular student answered it was the iliofemoral ligament, The iliofemoral ligament attaches the ilium to the femur, and it's actually on the anterior side here, running from the ilium, this is the iliac bone, ilium, to the femur. So first, you have to make sure you know the names of all the bones. So appendicular skeleton, critical for being able to answer questions about the joints. And then you have to look at where the what bones the ligament is attaching. In this case, it's attaching the ischium to the femur, and therefore is the ischiofemoral ligament. Here we are looking at the knee joints. You can see the femur here. Here's our tibia, and here is our fibula. It is critical that you're able to distinguish medial from lateral on this joint. Remember that the fibula is your lateral bone. So this is the lateral side. This is the medial side. Remember, the medial malleolus is down here, bone feature of the tibia. These little pads here are referred to as meniscuses, and because this is on the lateral side, this is the lateral meniscus. Again, lateral, you know lateral from medial because lateral is where your fibula is located. So this is the lateral side. Now let's discuss quiz number 6, which was muscles of the upper and lower limbs. Again, the average was pretty good, 71%. But again, only 17 students out of about 24 actually completed the lab quiz. And inspecting, who's taking the lab quiz and who's not, in this case, again, there were about 7 students that didn't take the lab quiz. About half those students were the same ones that didn't take the previous quiz. So I'm not exactly sure what the issue is with students not being able to complete these lab quizzes, especially when they're extra credit and they can't really hurt you. But they're preparing you for the upcoming practical. So that's a discussion we need to have. Now with this lab quiz, if you recall, I did neglect to post this when I was supposed to, and so I extended the time to complete this quiz till last Friday, the 27th. And I did send out a text message reminder to complete this. But I got, again, the same number of students completing this quiz as completed the previous quiz. For those who completed the quiz, again, the results are pretty good. We had 3 with over 90%, 3 80 to 89%, 2 70 to 79%, 7 60 to 69%, and only 2 less than 60%. So overwhelmingly, most students fell where I want them to fall, which is above that 60% level. On the quiz, for a couple of questions, I provided you with the origin insertion and asked you to identify the muscle. On the practical, I'm actually going to give you the muscle and then ask you to identify the origin and insertion. So how I'm asking for it here is actually sort of the opposite of how it's actually going to be asked on the actual practical. But for the quiz, I chose to do it this way because I thought it would be easier, and this was a week after you were introduced to origins insertions of the muscles of the upper and lower limbs. So I want to give you sort of time to sort of digest and start learning that material. Anyway, how do you go about determining what muscle this is that has these origins insertions? Well, when it comes to the pelvic region, you really need to, or pelvic girdle, you really have to identify, are we looking at the anterior side or are we looking at the posterior side? Because if we were looking at the posterior side, this very well could be a hamstring, right? Because the hamstring has its origins on the uh, ischium and has its insertions down around here, right? Sometimes, depending on which hamstring we're talking about, sometimes on the tibia, sometimes on the fibula, sometimes both. Here we're looking at the anterior side, and therefore this origin is on the pubic bone. How do you know this is the pubic bone? How do you know this is the anterior side? Well, two things. One, here's the sacrum here and the posterior side, and also look, this is the patella, your kneecap, and that's definitely going to be the anterior knee. So here we're looking at the anterior side, right? So the muscle with the origin here on the pubic bone and insertion down here on the medial portion of the tibia is the gracilis. While we're talking about origins and insertions, I want to remind you that you don't have to know the origins and insertions of all the muscles. There are specific set of muscles for which you need to know, be able to demonstrate the origin and insertion on a painted skeleton and demonstrate their actions. For all the muscles, you need to be able to identify them on a model and to be able to describe the movements they're responsible for. But there is a subset of muscles for which you need to know the origins and insertions. This is page 2 and page 3 of your study guide for muscles of the lower and upper appendages. And I just want to use these pages to illustrate this. So for the muscles of the hip and lower limbs, these are the muscles for which you only need to be able to identify them on a model or image and know their movements. How do you know this? It says, identify the muscles listed below and demonstrate their movements. For these muscles and these muscles here, you should be able to identify the origin and insertion and demonstrate their actions. It says on a painted skeleton, but I was very clear in class, it's going to be on a white skeleton. Painted skeleton was for you to practice and learn. On the actual practical, it's going to be a white skeleton, but it's only these muscles for which you have to know the origins and insertions and demonstrate their actions. Please do not try to identify, don't spend time learning the origins and insertions of these muscles. For the upper appendage, it's only these muscles for which you have to know the origins and insertions. Again, I tell you, for the following muscles, you must identify the origin and insertions and demonstrate their actions using the painted skeleton. There's a long list of muscles on page 1 that you only have to be able to identify them on a model or an image. Don't learn the origins and insertions of those muscles. Also make sure that you can list the muscles of the rotator cuff. And the thing to remember is sits: supraspinatus, infraspinatus, teres minor, and subscapularis. Consistently, students confuse the biceps brachii with the triceps brachii. Remember that the biceps brachii is on the anterior side of the arm. The triceps is on the posterior side of the arm. So wherever you see your elbow, which is here, you're looking at the posterior side. So this is the triceps, right? Take a moment, if this is confusing for you, to palpate the biceps and triceps on your own body. This is another image illustrating the triceps. Again, this is the posterior side. The posterior side of the arm is where the triceps is located. Quite a few students were thrown off by this question. So you were asked to identify this muscle here. And this is the teres minor. Below it is the teres major. A lot of students call this the deltoid, right? Because the deltoid muscle is in this area, but the deltoid muscle is superficial. It's been removed. If the deltoid was here, you really wouldn't have a good view of the teres minor at all, right? So on this side here, you have the deltoid, right? That deltoid is that if you just touch your shoulder, right, that's that large superficial muscle that if you flattened it out is shaped like a triangle, like a delta, right? You can see the teres major right here. You really can't see the minor that's under here very well because it's covered by the infraspinatus muscle here. But anyway, this is the teres minor and this is the teres major. Don't confuse it with the larger superficial muscle, which is the deltoid, which has been removed. Remember that this side of the model has been dissected compared to this side of the model. So even though you're looking at the same part of the body here versus here, you're looking at different muscles. Same thing, remember, with trapezius versus the rhomboids. Rhomboids are deep to the trapezius. So even though this is the same part of the body as this, you're looking at different muscles. Okay, let's make sure we don't confuse the gluteus maximus with the gluteus medius. And I understand some of the confusion because in some of the images from your book and lab manual, they don't quite match what you see on the models. So you have a gluteus maximus, medius, and minimus. You don't have to identify the minimus, so we'll not discuss that further. The gluteus maximus is the largest muscle of the gluteal region, and it's superficial, right? It's basically what you see if you're looking at someone's bare butt, right? Here's the gluteus maximus here. The gluteus medius is only visible if you remove the maximus, which has been done here on the left side. So the maximus has been removed, and you can see under there the medius. So this is the gluteus medius. This is the gluteus maximus. Make sure you can distinguish between the two, or again, you'll make a similar error on the practical if you were asked the same or similar question. In this question, you are asked to list the actions of the flexor carpi ulnaris. So a couple of things. If you are asked to provide the action of a muscle, always include the joint that it moves. Muscles do not move appendages, they move joints. So you would need to include wrist in this answer because the flexor carpi ulnaris flexes the wrist. Also, with the wrist flexors and extensors, the name tells you what it does. I actually have had students, when asked this question, flexor carpi ulnaris, what does it do? They'll say, I had some, they'll say, well, it extends the wrist. Again, a flexor is not going to extend anything, and an extensor is not going to flex anything. So, you know, if the movement is in the name of the muscle, it tells you one of the things it does. So your flexor carpi ulnaris has origin on the medial epicondyle, and it extends along the ulna. It's in its name. Therefore, not only is it going to flex the wrist, but it's also going to adduct the wrist. Imagine a string running from your medial epicondyle of your elbow all the way up to the medial section or medial portion of your hand, and then pulling on that string. What is it going to do? It's going to flex the wrist, and it's also going to adduct the wrist, and that's what that muscle does. In this question, you are asked to list all the actions of the biceps brachii. And the biceps brachii has 3 actions. One of those is to flex the arm at the elbow, or you could just say flexes the elbow. This is exactly what I'm looking for in an answer. Always include the joint. So we say it flexes the elbow. We don't just say it flexes the arm. You can say it flexes the arm at the elbow, or you can just say it flexes the elbow. Always include the joint. The only times where you can exclude the joint would be for dorsiflexion and plantar flexion, because they only occur at the ankle. So if you say it plantar flexes, it's understood that it's the ankle that you're referring to. The other is supination and pronation. We're only looking at that movement at the forearm. So supinates the forearm, pronates the forearm. That also is an acceptable answer. So looking at the rest of this answer, flexes the arm at the elbow, that's great. Is the antagonist of the triceps brachii, which extends the arm at the elbow. That's true, but that's not really its action, right? If you know that the triceps extends and you know that the biceps flexes, then by definition, it's an antagonist. You do not have to provide the antagonistic muscles. I provided you with tables that provide you with the antagonistic muscles, but that's only because some students like to study the antagonistic muscles at the same time. They like to study the biceps at the same time they study the triceps, because in general they're found in the same location and they move the same joints. But let me make it clear, you do not have to know, nor will I ask, for the antagonistic muscles of any muscle. The other 2 actions of the biceps brachii include it flexes the shoulder, or you could say it flexes the arm at the shoulder. It also supinates the forearm. Again, always include the joint. Flexes the elbow, flexes the shoulder, supinates the forearm. You're asked to identify this muscle right here, and this is the sartorius. A lot of students confuse this muscle with muscles of the quadriceps, so we'll look at that in just a second. But one way you can distinguish the sartorius, it looks different from any other muscle. It is extremely long and thin, and it crosses from the lateral side, where it has its origin on the anterior superior iliac spine, and then it crosses over and inserts down here on the medial side of the tibia. And again, it's very thin, so it should be very conspicuous, easy to distinguish between from the quadriceps. Right here you have the rectus femoris, here you have the vastus medialis right here. Let me show you this contrasted with this image here. Right, again, here's the sartorius here. Sartorius forms a V with the tensor fascia lata here on the lateral side. But again, here's a rectus femoris, big old muscle right down the middle of the thigh. Vastus medialis, vastus lateralis, much different in shape compared to this thin sartorius muscle that again has origin up here on the lateral side and then inserts down here on the medial side. Okay, now I'm going to do something I've never done before, and I'm going to actually give you the breakdown of the lab practical that's coming up this Thursday. So 19 questions will come from the appendicular skeleton. And the appendicular skeleton is critical for you to know the origins insertions, as well as to identify the structures of the joint. So even though the appendicular skeleton is only going to be 19 questions, which is a pretty good chunk, knowing the appendicular skeleton helps you with the joints and definitely helps you with the origins insertions. Joints, there'll be 9 questions, and those questions could be, what type of joint is this, or it can be, identify the structure on the joint, on a joint model. body movements and muscles. So this includes all of the body movements of the various muscles, as well as being able to identify those muscles. So this would be the muscles of the head and neck, muscles of the abdominal wall, muscles that move the upper and lower appendages. Here, you'd be asked to identify the muscles or to give the movements that the muscles are responsible for. There will be 8 origin and insertion questions. Really, it's only going to be 4, but each question is going to be worth twice as much as the other questions, because part of it, you're going to have to know the origins, insertions, that's 1, and then demonstrate the actions. But it's actually only going to be 4 muscles that I'm going to ask you origin, insertion, and action questions on. And then the remaining 13 will come from the nervous system that we covered in the last lab. So the anatomy of the spinal cord, the spinal nerves, the plexuses, the peripheral nerves, dorsal root ganglion, meninges, etc. Remember that we will not, I repeat, will not be covering the brain on this practical. I pushed that off to the next practical. So that's the breakdown of this practical. Make sure you're getting into the learning lab and you're using the Quizlet. All of the information from all these labs is also found on the Quizlet. It's been updated. Thank you.